everyone, and welcome back to Clinical Research and Tea with Jet. Today, for Women's Health Week, we're talking about two important and often misunderstood topics: tubal ligation and abortion methods. We'll cover what they are, how they work, and the facts you should know so you can make informed health decisions. Tubal ligation, often called getting your tubes tied, is a surgical procedure for permanent birth control. It works by blocking or cutting the fallopian tubes so an egg can't travel to meet sperm. After the procedure, your periods continue normally and sexual function is unaffected. While it can sometimes be reversed, only about 50 to 80% of women become pregnant after reversal. It does not protect against sexually transmitted infections, so safe sex practices still matter. Reasons for choosing tubal ligation include being certain you don't want future pregnancies, pregnancy posing health risks, and avoiding passing on genetic disorders. Tubal ligation is generally safe, with serious complications in fewer than 1 in 1,000 cases. Risks include bleeding, infection, damage to abdominal organs, ectopic pregnancy, and incomplete closure leading to pregnancy. About 1 in 200 women may still become pregnant afterward. Certain conditions like diabetes, lung disease, or a history of pelvic inflammatory disease can increase risks, so it's important to discuss your health history with your doctor. Globally, about 73 million induced abortions happen each year. 6 out of 10 unintended pregnancies end in abortion. And when performed safely by trained professionals or with recommended medication, abortion is a very safe procedure. There are 2 methods. One, in-clinic abortion, performed by a healthcare provider in a medical setting. And the second is the abortion pill, a combination of mifepristone and misoprostol or misoprostol alone, used up to 11 weeks of pregnancy. The process involves blocking the hormone progesterone and then using medication to empty the uterus. Effectiveness rates are above 90% and can be as high as 99% with proper dosing. When abortion care is safe and accessible, complications are rare. However, around 45% of abortions worldwide are unsafe, often due to the lack of access to trained providers, accurate information, or quality medicine. Unsafe abortions are a major preventable cause of maternal death and health complications. And right now, there's a lot of states that still find abortions to be illegal. So make sure that you find a state that is performing these legally. And make sure you trust your instincts and make sure that it's a licensed provider. So whether you're talking about preventing pregnancy permanently through tubal ligation or safely ending a pregnancy with approved medical or surgical methods, the most important thing is access to accurate information, qualified care, and the right to make decisions about your own body. With the reversal of Roe versus Wade, I know that right now it's been a tough time for women, especially when it comes to our reproductive bodies. And I'm sorry that we're in this, but we need to try and do what we can to be safe and to make good decisions when it comes to our body. We know what our body needs more than anyone. So, thanks for having a cup of tea with me for this Women's Health Week discussion. Be sure to like and subscribe and share. See you next time so we can have another cup of tea together. Bye, everyone.